Can VNS stimulation settings be optimized faster for epilepsy? Imagine finding the perfect balance between controlling seizures and avoiding side effects. That's what vagus nerve stimulation therapy aims to do for people with epilepsy that doesn't respond well to medication. It involves sending gentle electrical pulses to the left vagus nerve, which helps reduce how often seizures happen and how severe they are. But figuring out the best settings for each person can take time. The question is, can we make this process faster? Right now, doctors usually adjust the VNS device slowly over weeks or even months after it's implanted. They start with low settings and gradually increase the intensity, pulse width, and frequency. This slow approach helps ensure the patient tolerates the therapy well and side effects, like hoarseness or throat discomfort, stay manageable. It also allows doctors to see how the patient responds over time. Because epilepsy varies so much from person to person, this gradual process is often necessary to find what works best for each individual. One of the biggest challenges to speeding up this process is that the effects of vagus nerve stimulation are not immediate. It can take many months before a person notices significant seizure reduction. Plus, increasing stimulation too quickly can cause side effects that make the therapy intolerable, leading to poor adherence. Individual differences in brain anatomy, type of epilepsy, and how the vagus nerve responds all play a role, making a one-size-fits-all approach impossible. However, recent research offers hope. Scientists are exploring ways to predict who will respond better to VNS and how to personalize settings faster. For example, some studies suggest that people with focal epilepsy, where seizures originate in a specific brain area, tend to respond better. Advanced programming techniques and new systems that can adjust stimulation automatically based on physiological signals are also being tested. These closed-loop systems aim to tailor therapy in real time, potentially reducing the time needed to find effective settings. A 2025 study from Norway looked into optimizing stimulation parameters more precisely, hinting that faster, more targeted adjustments could improve outcomes. But it's important to note that these approaches are still in the early stages and need more validation before they become standard practice. Safety remains a top priority. Increasing stimulation too quickly can lead to side effects that might discourage patients from continuing therapy. That's why clinicians still prefer a cautious, step-by-step approach. It's about finding the right balance between effectiveness and tolerability, which can take time but is essential for long-term success. In practical terms, patients and doctors should expect a gradual process after VNS implantation. While future innovations may help speed things up, current best practices involve careful, personalized adjustments over time. Patients should stay in close contact with their healthcare team, who can monitor progress and make adjustments as needed. Remember, every person's response is different, and what works quickly for one might take longer for another. The goal is to maximize seizure control while minimizing side effects, and that requires patience and personalized care. As research advances, we may see faster ways to optimize VNS settings, but for now, a careful, individualized approach remains the safest and most effective method.